Good afternoon. I'm Erin Murphy. I'm a member of the Minnesota Senate and a licensed registered nurse. And I am grateful to be here today with my colleagues and with the essential workers as they continue to tell the story of their experiences on the front line of a global pandemic that is not yet done with us. One of my early and permanent memories of the global pandemic is the faces of healthcare providers in the early days after they'd take off their masks and all of their protective equipment, and we would see their faces with bruises and open sores. That was because we didn't fully understand how this virus was transmitted. And so inside hospitals and nursing homes, especially in hospitals, healthcare providers were wearing as much protective equipment as they could muster, knowing that supply lines weren't providing PPE, and they were working very hard to try and protect themselves in the course of a pandemic that we didn't fully understand. Basic infection control will tell you this: until you understand the exact way a virus is transmitted, we treat everybody as universally infected. We went into a peacetime emergency in the state of Minnesota and across this country because we didn't fully understand the risks of the virus, but we knew that it was deadly. Most Minnesotans were sent home from work, but a group of Minnesota workers were told they had to go to work. They were essential. They were essential to keep our hospitals functioning, our nursing home functioning, our grocery stores functioning, supply lines functioning, so people could stay home and live. Those essential workers are still working on the front lines of this global pandemic, and they have all borne risk, regardless of where they worked, and they are all now worthy of frontline worker pay. And it is, I will say for me, quite offensive that some of my colleagues would propose to exclude the very, very difficult work that essential workers did across the state to keep people healthy, to keep people alive, and to keep our economy moving. What we proposed in the work group in August is a solid proposal that is fair, it's functional, and it's meaningful. And it's time now for our Republican colleagues to stop throwing down roadblocks, whether it is the threat to a commissioner or a proposal that excludes people, and come back to the table and finish this work so we can get the $250 million that we have designated for frontline workers into their pockets, to reward their work, to recognize their effort, and to fuel the continued effort that they're going to need as we continue to muster through this fourth wave. We brought this legislation during session because there were workers who lost time because they had to quarantine. They lost wages because they had to quarantine. They used their own leave time because they had to quarantine. We know those workers got sick, and as Representative Frazier mentioned, many of them died. There were industry lobbyists at the time who refused to support that legislation. Those same industry lobbyists are now at the table saying that we should give the lion's share of this money to a small pool of their workers by excluding others. That's not right. As you listen to the workers, and we have heard testimony all summer long from frontline workers who experienced the same level of risk because we didn't know where the infection rested. And if you're exposed, you're exposed. Some would argue that if you're in a hospital, you might even be safer because the system is set up to prevent infection. People who worked in meatpacking plants didn't have that same protection, nor did the people who worked in grocery stores. So from my perspective, it is ludicrous to segment frontline workers and to say some are worthy and some are not. We have a fair, functional, and meaningful proposal, and it's time for the Republicans to join us again and get that work done for the frontline workers. Thank you.